Teledentistry, what is it? Go to teledentistry.operadds.com to find out how you can completely change how we bring in new patients, giving them the ability to send photos and video before you ever talk to them. Go to teledentistry.operadds.com. Welcome to the Operatory Podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find just a better way. With me, as always, is the dancing man himself, David Pryor.
Hey, Bryan.
Hey, my man. How are you doing?
Good.
Well, I am glad that you are here today again, providing the patient perspective for our audience.
I'm happy to be here.
Well, good. Well, we have a good topic today, my man, that I think our audience will resonate with.
All right.
It's what I like to call the dentist tax.
Okay. Knowing what you're going through right now, I'm very excited to hear that.
Well, in Minnesota, we have a special tax, which is the provider tax. So we get to pay 2% of every dollar that comes in our practice, basically to fix roads, because it's Minnesota. Minnesota and California are the two states that I think you just get
Taxed to death?
Taxed to death, exactly. Yeah, it's just coming back from Nevada where it's like, oh, everything's great here because we pay no tax. And I'm like, great, that's nice. But I'm going to go back and freeze and pay 2% for the privilege to be a healthcare provider in Minnesota. Yeah, so no, thanks for kicking me on that one, Dave. I appreciate that. No, the dentist tax is something different. They pay this in Nevada too.
Oh, good.
So now I've just got to ask, and I hate doing this to you. Actually, I like doing it to you. I do like doing it, but it's something that you make fun of me for doing because you're the blank slate,
yep.
The magic ingredient,
yes.
With no idea what we're going to be talking about coming in here. But yet I ask you all the time. I put you on the spot. So I'm sorry, not sorry to do it to you again.
You're not sorry at all.
Well, I'm pretending to be sorry.
Live with your guilt.
Okay.
All right.
So to a patient, to somebody who should have no idea what the dentist tax is, what do you think it is?
What do I think it is? What is it? I'm going to guess that a dentist tax is a tax for somebody that makes has a large income. And so they are charging you extra because you're going to make so much more money than the average person.
Well, I would think that that's a great way of stating it from the patient's perspective, right?
Yeah, I mean, I'm doing this from the patient.
Yeah, because
not being Bryan's friend and knowing the 8 million taxes that you do pay.
Yeah, I hear you. I hear you. Yeah. And number one thing you said, dentists make a lot of money, right? People just think that.
Yep.
If there's a dentist in the news, they mention that it's a dentist because it's like, oh, look, this sort of like person who makes a lot of money. Right.
Yep.
What that translates to is the dentist tax that, from my perspective, that we pay more for everything.
Yes.
Right.
Yep.
And in particular, I want to talk about software.
Okay.
Because there's a huge dentist tax when it comes to software.
Really?
Right. Yeah. Now, you might not realize this as much because we obviously have a software company that we are trying to, one of the things that we're trying to do is be the anti-software company in dentistry. We start off just like giving away secure email for free and digital case collaboration for free. And now we are like bare bones, like we do for a big one. We just came out with recall for $149 a month, right?
Yep.
You know what it costs on our end to provide this service. And that is incredibly cheap.
Yeah.
I mean, huge value, right?
Right.
Versus charging $400 a month and then like just tacking on extra crap all of the time.
Right.
So you now you kind of see where I'm coming from?
Yeah. Dentists pay a lot of money because there's a lot of different applications to help you be successful in dentistry. And there's a lot of different faucets that are turned on at the same time to try to elevate your business acumen.
And versus allowing dentists to tailor solutions to their own practice and paying for what they're using, which is what we try to do, right?
Yep.
I don't even know of another solution out there that does that. It's just like,
no, there isn't.
You know, you want to buy the steering wheel. Here's the whole car that you have to pay month after month after month. It doesn't make any sense, right?
Totally. Well, I mean, from my perspective, from my seat as your head of sales, it's an awesome position to be in because since I don't have any competition that does that splits things out, and it makes it really easy for me to sell.
Yeah. So, since starting the podcast, you've come on and at sales. When we first started, you were
Right.
just the patient providing perspective, right?
For sure.
Which has been a fun transition. But so from that perspective, do you feel that dentists are kind of, do they acknowledge the dentist tax? Do they?
Yes.
Okay. So they feel that pressure going on.
Totally, all the time. Every dentist is sick of somebody reaching into their pocket to grab a little bit of money.
Yeah.
It's and about once this is the time of year. So it's November here in Minnesota where the snow is just starting to fly, and this time of year, I noticed from last year, is the time where doctors start to take a look at their practice and they say to themselves, "What am I spending money on that I can just trim back?" And I remember this happening last year because we have the way our product is set up, you can consolidate a lot of different vendors into just us at a lower cost. And so I had a ton of business come in as a result of doctors taking a look at their practice and saying, how can we save some money?
I think what's really happened, this was a big sort of revelation to me. Sometimes not knowing something kind of leads you to somewhere where you didn't think you were going to end up. And allow me to explain. Mm-hmm. I started off with Opera DDS with a solution, and then I was like, oh, I'm a dentist. I don't know anything about technology, so I'll learn about technology and apply that to dentistry. And so we came in extremely low priced, easy to use, right? Very convenient, and nobody understood it because everybody in dentistry is trying to exploit dentists,
yes.
frankly, right?
Yep.
And then there's been this thing where we've actually put downward pressure on the other software companies. We get some negative feedback from other software companies, basically saying that we're too low priced all of the time, right?
Yep.
And then they have this pressure to frankly, I think we are fairly responsible for some companies lowering prices. I'm saying that. I think a little bit modestly, right?
That is undoubtedly the case. And you know who you are if you're listening.
And sorry, not sorry. It's like the Dave earlier. But the other piece is just like having to charge for it, but then to make up for it, what they're doing is they're adding on features that we may have inspired, and then just charging more for it too, right?
Oh, for sure.
So I don't know where I made this. This is a podcast where I took off without a landing, but I wanted to at least acknowledge the fact that there is this dentist tax going on. That I, as somebody who's a dentist that came up with technology, came back at the industry trying to go how it's done outside the industry, and frankly, it was like from outer space. It was like, why are you doing this? That's not what dental software companies do. We tax dentists horribly, and it's just not right.
Right. Yeah, no, and like when I'm having conversations with prospective customers about where our perspective comes from, that it really takes a lot of pressure off of their end, because I'm like, this is a company that's owned by a dentist, so everything that happens here comes from his perspective and his vision, and not from a big corporate conglomerate that's saying we're going to create something where we're going to create this huge revenue stream. We're looking at it from a perspective of, we create a product for ourselves that's awesome because we see a gap in the marketplace, and then we present it back out to everyone else saying, hey, this is awesome. We want you to be able to have it. So here, let's put it out there at a reasonable price and expect that everybody's going to love it. And, I was telling Bryan earlier today, like, our attrition rate is incredibly low compared to other software products that I've sold in my life, because it works. It does exactly what offices are looking for.
Oh, we want to give at least 10 times the value on everything, right? Yeah, for sure. And I mean, that's the low end.
Yeah.
And I think that you hit on another point. I don't think a dentist who's out, doing dentistry all day long, running your practice, probably realizes that what's going on in the back end of most software companies. I just kind of want to expose that a little bit. Most are private equity backed, which means that they are going to turn every 3 to 5 years. So say someone gets a bunch of money, the only thing they're doing is trying to sell as much as they can, get as many people hooked on it, so then they can increase their multiple and sell again in a few years. There's nothing about service or creating features that help dentists. It's just about like creating a product that somebody will buy for the most amount of money and then moving on to the next one.
Right.
Which is just, I mean, and the reason why there's a lot of software vendors doing that in dentistry is because dentists will pay a dentist tax because we're used to it.
Yep.
Across everything.
Yep.
Right. You know, that's kind of what happens. And so I think that we as dentists do pay too much for stuff. And so, but there are lower cost alternatives for pretty much everything. And you know, and that's from a guy that I'm willing to pay for the best stuff, right? I mean, I would never, we just finished a podcast where I was talking about, like, if you're buying a CAD CAM system, buy from a reputable source because you want to have support after the fact, right?
Yep.
Now you might not need to buy like the biggest, most expensive version of it. You can buy the one that's tailored to your practice, but buy a system that is reputable, that, you know, you can, there are some things to spend money on, right?
Yeah.
But there's also, I mean, you do not need to pay for a bunch of monthly software fees that you don't need to, you know,
Right.
Because there's systems like Opera DDS where we try to make that affordable.
Yeah.
So thank you very much, Dave.
All right. Thank you, Bryan.
I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.